It's a pleasure to meet you all and to share with you our solution to fight anemia. Anemia affects 1 in 4 people, probably even someone close to you, but they may not even know it. Why? Because it's often not diagnosed, and that means it's not treated. And that's bad news for children, pregnant women, and people with cancer and with cardiac and renal diseases. And it's bad news for the healthcare system too. And the problem starts with my friend, Dr. Fernando. He's a GP, and his patient, Maria, has cardiac problems. And that means a 50% chance of iron deficiency. So Dr. Fernando tested her, but just one test. And actually, Maria needs several different tests she doesn't get. As a result, she's misdiagnosed as clear. If we could treat her for iron deficiency today, it would only cost us 200 euros. 1 month later, Maria is suffering from anemia. She is now in hospital, where treating her costs 2,000 euros a day. 2 weeks later, Maria's condition is worse because she was diagnosed too late. She's now in intensive care, where treating her costs 20,000 euros. 20,000 euros instead of 200 if we got the diagnosis right first time. Misdiagnosis is costing us millions. Misdiagnosis starts with Dr. Fernando. So our solution is built by doctors for doctors to improve patient care. So how do we help him? First, we give him a test that's both reliable and affordable. He gets Maria's result in real time, just 5 minutes. Second, we give him a digital expert assistant. It turns data into diagnosis. He also gets a full range of cartridges, so he can reliably diagnose anemia in all cases. Our digital diagnostic platform helps Dr. Fernando find the reason of Maria's anemia and stop it in time. We have competitors, of course. There are other point-of-care testing technologies, but they are for hospitals, not GPs, and of course, traditional labs. But they don't offer real-time diagnosis or expert advice. Fideliomed is designed for primary care providers, is the best choice for price and for usability. We worked hard to finalize our device. We have a strong IP protection, a clear regulatory pathway, and an easy manufacturing process. We will follow a B2B model. It will target doctors and pharmacies, and it will be country-specific. In Italy, we'll go for pharmacies first. In Germany, doctors first. We'll start with a strong presence in the USA. In the USA, Fideliomed is a profitable asset. Why? We can cover reimbursement costs with high levels of profitability. So we have the keys to fast adoption. Last year, we started the industrial development. This set us up for clinical validation. For that, we need 2 million euros. In June 2025, we go to market. Our team is skilled and committed. By working together, we are turning our idea into a concrete digital diagnostic platform. We are not alone. We have an extensive network of partners in science, technology, and industry. Our product has been recognized by investors and strategic partners aligned with our vision. We hope you will support our team. We solve a global clinical need, have a huge market opportunity, and a proven technology. Our mission is to help Fernando, Dr. Fernando, give Maria and all his patients the best possible treatment for iron deficiency and anemia.
Maybe a first question regarding your clinical validation roadmap and also your regulatory roadmap. Could you maybe elaborate on the two?
Yes, so of course, thanks for the question. So our prototype has been validated in a preclinical, through a preclinical validation. We got a high level of accuracy. Now the industrial validation is in progress to get the final device and to have the clinical validation that will be in 5 different centers, 2 clinical centers, 2 in the USA and 3 in the Europe. We will test common test for anemia and iron deficiency using our technology and the gold standard. And this will be the final clinical validation to get the regulatory approval. Our regulatory strategy is to have the regulatory dossier ready for the USA FDA approval and the CE mark together, but we want to get first for the FDA approval. The device is a class 2 for FDA approval and a class B for the CE mark, IVDR.
A quick question for me on the market size. Have you quantified it? How many tests are performed for anemia and iron deficiency on average? And like, how does that translate into the market size?
Oh yeah, great question, Marta. So the market size in terms of the market iron deficiency and anemia diagnostic opportunity worldwide is 3 billion today, and it covers less than 30% of the tests that will be useful according to the clinical need. This is the current market size with a great room to improvement. So we using a point of care test, of course, the aim and the goal is to improve the number of tests that will be get.
Thank you.
One question from my side. How do you plan on distributing your product?
The production is okay. We are working with a manufacturer based in Berlin. So we have different suppliers, a supplier for the BER sensor, a supplier based in Berlin that will modify the BER sensor to get the final consumable, a supplier for the hardware, and the final supplier for the mobile app. So a network of international supplier with Fideliomed as legal manufacturer that is lead the overall production.
Okay, thank you. And maybe a quick follow-up on how do you plan on distributing your product to your customers?
Yes, of course. So our business model is a B2B. Our strategy will be an hybrid strategy. Fideliomed with the business development task, and we will partnering with a couple of distributors in the USA and in Europe with a strong focus in selling these kind of products in doctors' offices and pharmacy chains.
Okay, thank you.
Thank you.